The following is a paid program and does not necessarily reflect the opinions of the staff or management of Visionary-related entertainment.
Aloha and welcome to Maui Nonprofit Notes. Each week on this show, you'll find us talking story with Maui's nonprofit executive directors and staff to find out how they're working to support those with needs within our community. Maui Nonprofit Notes is generously sponsored by Pacific Source. If you're building or remodeling a home, please stop by Pacific Source's Cabinet and Appliance Showroom, located in the Waikapu Bayshard. I'm Susie Tiemann, Executive Director of Lokahi Pacific, and your host for Maui Nonprofit Notes. During this hour, we share some of the experiences of our nonprofit agencies and just how they're changing lives, changing communities, and creating miracles of hope for those with needs. In today's show, we're going to be talking with the folks from Naho Aloha and from, let me get this right, Hui no Ke Ola Pono. Close enough, huh? Very good, okay. I don't know why we got two agencies on with difficult names for me to pronounce. Usually I have just an average name, Maui Farm, something like that, and then Naho Aloha. And so I only have to concentrate on one. But today, for some reason, whatever, it's a challenge.
Do the English, it's loving friends.
Loving friends, that's true, that's true. And we're going to start off here talking with Candace Carter, who's the executive director.
For another week.
Well, now let's be precise about this. For 7 more business days.
Yeah, I guess that's right.
Something like that.
Right.
Anyway, not even the end of the month do they let her go. She has to stay until Friday, which is the 2nd. Because, I don't know, it was...
I booked my air flight that day.
Oh, I see.
Leaving, might as well work to the very end.
We often say that it's like, don't let them go, but if you have to, make it hard as you can. And I think working until 4:30 and then catching a flight, that's one that you're saying goodbye to the islands is a tough one.
I don't have time to think about it.
Until you land over there and you go, what have I done?
Oh, I already did that.
Oh, been there, done that. You're actually returning to the mainland.
I am. I was in Texas prior to coming here, but of course, I'm a local girl from Oahu, and I felt fortunate to take early retirement from AARP, and then move to Maui and be a part of this most amazing organization. So, so this time I'm going back. I left my kids and grandkids in Texas, so I'm going to go back and be a part of their life.
How long have you been here this time?
5 years.
Has it really been 5 years?
Yeah.
That doesn't seem possible.
I know.
But what you've accomplished at Naho Aloha is unbelievable.
Thank you. I think it's just the staff and the volunteers who do the work. I just get to sit in the big girl chair.
Oh.
Which Barry gets to sit in next.
Now is that your approach to management?
Yes, that's pretty much it.
Sit in a big girl's chair.
No, we're such a good working team together that everybody pitches ideas, work on grants together. We provide fundraising opportunities, provide support to volunteers and our participants. So everything is planned as a team. We do strategy development sessions, and we just work together well.
I think it's incredible that all of the folks that actually are out there doing the work are volunteers.
Oh, yeah.
Your paid staff is how many?
The paid staff, 3 full-time, 1 part-time.
That's incredible for the number of people.
Well, and the
hours.
number of people have jumped. Every time I come on the show, Susie, we talk about, oh my gosh, how did you hit 300? Oh my gosh, how did you hit 400? So today I can tell you we're almost at 750.
Oh my gosh.
So that's a lot of people to be serving for Maui County, and of course we provide services on Molokai and Lanai as well. So those are our participants receiving services, and we have 250 volunteers that are actually delivering the service.
So when you take a look at that, that's like 3 people for every volunteer.
Yes.
But I'm sure it doesn't work out quite that way.
Not quite.
When you think of the agency, what's the one thing that really stands out to you about the agency and what it does?
Purpose and compassion. All the staff and the volunteers give so much to take people to doctor's office, take people grocery shopping, medication, become friendly visitors, to help reduce social isolation for our homebound elders. So I think of it as an energetic, just an energy organization.
That's great. Now, the volunteers that you have run you run a pretty wide range of ages.
Yes, we do. We have intergenerational volunteers, so some of our volunteers are 15, 16, and they participate in fundraising events and some community outreach opportunities. And actually, our oldest volunteer is 86 years old. She was in the office today.
Oh my goodness! So she's doing what some of your volunteers are doing for others.
Well, she was providing rides up until today. She took her license.
Oh, ouch.
So I mean, we talk about it's a vision thing, not
Right.
But we talk about people who give to every drop of energy they can to the end to help people in this community, and she's one of them. Very special lady.
Oh, how sad for her to have the vision problem and have to give it up.
Yeah.
She now will understand totally what she has been helping others do.
No, we already put her to work. So what we did is we just changed her volunteer role. Instead of being a transportation volunteer, one of the things that we're really trying to reach out to the community to reduce social isolation is telephone reassurance. So she will, while she's home, she'll be calling people that are homebound and having conversation, remind them to take their medication, and just talk stories so they're not alone. So she's already volunteering in a new role.
Wonderful. And now will she be receiving services?
She's not there yet.
She's not there
No.
yet? Okay. Mm-hmm. She doesn't need the ride yet?
No.
Okay.
She's going to get cataract surgery instead.
Isn't that incredible? I just, you think about this, and we laugh about ages, talking about somebody said 70's a new 50,
Yeah.
60's a new 40. Well, then 86 must be the new 66.
Yeah, that means I'm 40. I'm retiring at 40.
Well, I'm sure you will find something to do.
Yeah, most definitely.
I can't see you just
No.
thinking about what you've done, which is tremendous.
Oh, thank you. Well, it's been a great organization and just, again, tremendous volunteers and tremendous staff. So I've been fortunate, and I really have been fortunate and appreciate this opportunity to be able to be in a position to serve our community. So.
There was one program as I went through your website that really got my attention, and that was the Falls Prevention Volunteer Program.
Yes.
There's probably nothing more scary to a senior than falling.
Oh, I know. Well, especially when you look at the statistics, when you look at those number of older adults who fall and go into emergency room, 40% will never return home again. And with that group, 25% will die within the first year. So it's a huge issue. So we make every effort. We've got volunteers that are trained to do in-home safety inspections, if you will, the risk assessments, move the rug, no more water on the floor, that kind of stuff. And we also provide information to the community workshops, and we make sure we get the information out. And now we're getting referrals from agencies to go in and do the in-home risk assessment for falls.
That's great.
Yeah, it's good.
I have a friend who's in the senior category, and just in the last couple of years, I've noticed that when she goes in her house, she sets stuff down on the floor as she's walking. Sometimes she's in a hurry to go to the bathroom. You know how that goes with seniors as well.
I'm 40.
You don't know.
I don't know.
You've heard the stories.
Yes.
Anyway, so, and I can kind of understand that. But other times, no rush, just walks in, and instead of putting it up someplace or putting it away like,
Right.
we should be doing, just puts it on the floor. And every once in a while, I'll go through in the house and I'll go, what is all this stuff on the floor? Oh, that's stuff from Thursday when I went to so-and-so, and that's from Tuesday when I went such and such.
Oh, my gosh.
And I said, why do you put it on the floor? That's a hazard. And she says, oh, I know it's there. And I go, you don't ever jump up to run to catch the telephone?
Right.
Well, yeah. Or to catch that boiling pot on the stove? Well, yeah. And you're going to remember in that moment that bag is laying there with the handles on the floor, perfect for you to catch your foot on.
Absolutely.
And splat.
Yeah.
And, it's like, I don't understand this.
Yeah, and you would think that that's something that we'd automatically do to prevent that such of incident from happening. But even in everyday life, actually did an in-home assessment. And I was really surprised. This wonderful lady in her home, we walk through usually the high-risk areas or the bathroom because people will fall if they don't have a nightlight, so get a nightlight. Anybody over 40. So what happened with her is I went into her bathroom and she had like a hand towel for her stepping out, for her mat, for getting out of the shower. And I go, Auntie, that doesn't have any rubber backing or anything. And she said, I cannot lift with my wrists, too hard to lift. So that's what she was using. And I said, no, we're getting you a regular mat.
Right.
Yeah. So.
So she thought the process partway through.
She did. I said, let's call family and just make sure if you need any assistance, they can come over once a week, take it out, wash it, whatever you like. But this is not going to be safe for you.
Well, she thought to the extent that she needs a mat there.
Right. It's a hand towel, not a mat.
Yeah, right. Use it for what it's meant for. Right. That's incredible.
Yeah.
But it's. I think we just got an idea what to give her for a going away present, didn't we?
The mat, we already got the mat.
No, it's not the mat. It's the nightlight.
Oh, the nightlight.
Anybody over 40, she said. She just told us she's 40.
That's right. What can I say? That's right.
So we get her a nightlight. But, I mean, I can't think of anything scarier than falling and being the cause of the falling. Is something you did.
Right, and people say that. I was really stupid. I went too quickly, or I didn't have the nightlight. So people are aware, but by that time it's too late.
Now, a lot of the new cell phones have the emergency. What is it? Is it a 911 call, or what are they calling when they hit that star on the phone or the whatever it is?
Somebody, I don't know.
Does anybody? You don't know? Oh, okay.
I've never had a call.
I thought you guys were into all that stuff.
No.
Okay. But and I mean, there's obviously services you can buy where you wear the pendant or whatever and stuff, and help I've fallen, kind of thing.
And that's where the telephone reassurance program helps too. If you've got somebody who's receiving a call daily, volunteers are trained that if something isn't quite right, people aren't picking up the phone, and that they're homebound, that they're not going anywhere, or we don't hear from people for a couple days, they don't talk to their friend for a couple days, they will call staff and then we'll check into it. We've actually had a situation where it resulted in being able to help somebody who could have been a very serious situation. So anyway, the volunteers are a really active part of wellness as well for our seniors aging in place.
And I have a sneaking suspicion we don't understand how many seniors are out there living on their own because they refuse to go to, maybe they don't need a nursing home, but a senior home, or can't afford a senior place.
Or they're not options. I mean, we've got incredible housing here, Halimaha'ulu, but the wait lists are so long. And, and it doesn't just serve our community. This is a real beef for me. But, it's federal funded money. And so anybody on the mainland can apply to go there. So we might have people here born and raised, and they're older, no more family on the island. And they have to wait 6 years to get housing. And you might have somebody who's living in Alaska who's tired of the cold, and they get on the list and they come over. Just zero fare.
When their name comes up, they're on it.
Right.
Yeah. And that's one of the things that we don't do well, is think about stuff like that and get our names on lists in preparation.
Yeah. I would recommend right now that anybody who is thinking of senior housing, and if you're 60 years old now, go ahead and put your name on a wait list. Halimaha'olu.
There you go. I got you. So
we have a new program.
You got a new one?
Oh, we do. We have a great program.
Tell us about it.
Yeah, absolutely. We have a program for respite for caregivers. That's just a huge issue that's growing in this country. You've got lots of boomers, not enough people to really care for them. Plus, it's so expensive. And if you're aging in place, the only way you can really, for somebody who is really aging, becomes frail unless someone's taking care of them, then you talk about institutionalization. So the caregiver program helps to reduce stress for and keep the family intact. So they provide for their loved one at home. The numbers are staggering when you start thinking about the impact, because caregivers are many caregivers die, and I forget exact number, but die before their loved one because of the constant stress. They're 24/7 providing for their loved one. There's guilt, there's, just they don't go to the doctors, they don't take time away from their loved one to take care of themselves. So it's really high risk. And they're also don't get out to see friends. So they also become socially isolated. And in fact, one thing that I think is really telling about social isolation and the stress on an individual, social isolation is as harmful to the body as smoking 16 cigarettes a day. I know.
What?
Yeah. So we have a lot of people out there that, that simple call that they could get once a day, a few times a week, just to let them know they're a part of the community and that they're not alone. So if anybody is listening that can just give some time, 15 minutes every other day, something like that, it helps a person who has no other options to be engaged in the community.
I've got to think about that for a minute, and during that minute, we'll take a break.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we're back. This is Maui Nonprofit Notes, the weekly radio show where we talk story with our executive directors and their staff to find out what's going on in their part of the community. And I say that because we talk about different segments of the community, whether it's age-related, health-related, economics-related, housing-related. And we're talking right now with Candace Carter, who's the executive director for 7 More Days at...
But who's counting?
Yeah, she said she wasn't counting. At Aloha... Naho Aloha. Gosh, see, I knew I'd mess it up.
You're fine.
You've got to listen to this show. We'll let you know when your replacement is going to be on the show so that you can listen on your computer back in Texas and see if I'm ever going to get this right.
I trust that you will. You do it right almost all the time. So.
Naho Aloha. Mm-hmm. So now we were talking about your new program.
Yes.
And you had a few more comments.
Yeah, I just had a few more comments, and then I want to introduce somebody very special who's joining the team. But when we talk about caregiver respite, we have 2 new programs, and we're very fortunate. We've received funding from the Hawaii Community Foundation for persons in need, and those are people who are 65 and older with income less than $26,000 annually. And what we've done is we've taken this model that's been done in a few states nationally called Respite Education Support Tools. And we've had a core of volunteers and staff trained as trainers to train other volunteers to become respite companions. And so we're kicking off that program. We've done our first training. So if you know of anybody who needs a break and have somebody who is trained and certified to be in the home, remember we're totally hands off, but to be able to help with your family while you get away and take that time for yourself, please call our office, 249-2545, 249-2545. The other program we have also in respite is we can provide a limited amount of assistance, again, under the Hawaii Community Foundation Persons in Need Grant, where we can provide some financial assistance so you can choose the person and pay them to care for your loved one and get some time away. So 2 very important programs. We're really reaching out to try to help caregivers. So that's it. I just wanted to make a real plug for that because we really need to move the program forward.
I gotcha. Well, now, just for a second, let's go back to your original program, which was the driving seniors to
Right.
doctor's appointments, grocery
Right.
stores, whatever. That continues.
Oh,
Bigger
absolutely.
and better than ever.
It is. We are on the road. We've got volunteers on the road every day.
And so now these are again our volunteers that are driving.
Yes.
They get reimbursed for their mileage.
At 55 cents a mile, that's correct, and we cover liability insurance.
Okay, so if anybody, are you looking for volunteers?
Absolutely, more than ever. 'Cause
Always.
we're getting, always. You know, we have people who can't get to their doctors without us. I mean, it's a very special service that we provide. And, you know, we're been gotten national recognition for our programs.
You
So
have.
We have. And we
Fabulous.
were people who made a difference. We were one of those.
I know
this
you
year.
were.
I know.
I saw that.
That's because of the volunteers. They're fabulous.
Yeah, they are. Well, it takes a fabulous leader to make fabulous volunteers.
Well, I appreciate that so much. I do what I love.
Or they made you look good.
They made me look good.
Yeah, it's a two-way street. It always is. It always is. And so now, 7 days from now, you're going to hand off the baton
Yes.
to the gentleman sitting to your right.
And he's fabulous. His name is Barry Gay, and he was a board member, so he already knows about the organization and, you know, has a real heart for helping our seniors within the community as well. So I'm just going to pass the mic right here carefully to Barry and
Ooh, this is,
let Barry
this is the
himself.
official passing of the mic here.
Can I keep this mic?
You got to talk to our engineer over here. He may check your pocket as you leave. Barry, how you doing?
I'm fine, Susie. Nice seeing you again.
Same here, same here. We go back a long ways.
A long time. For only being 40.
Yeah,
Yeah.
You too, huh?
yeah. I was 10, I think, about the time we met
Yeah.
30 years ago.
Yeah. Yeah.
Well, that doesn't seem possible.
I'll tell you, being on the board, I've witnessed the growth that the organization has gone through with Candace at the helm, and it's tremendous. She's moved Nahoaloha so far ahead since she's been there that it's big shoes to fill.
Right.
So I hope to continue what she's done.
He's got pretty big feet, so I think he's
I know.
used
I
to
was
big
just
shoes.
looking down there
Yeah?
and going, whose shoes?
He's got a good base.
Yeah.
So, but now, Candace, you were what, the third executive director?
Oh,
Or just
I
the
think
second?
we're 20 years old, so.
Yeah, but
You know
Ja-
what?
Janie?
No,
No.
Jerry.
Jerry.
Jerry was before me,
Yeah.
correct. So in a matter of, about 4 years, this is the third. Yeah.
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 So, I mean, the concept was great. I remember interviewing her before she left.
Yeah.
The concept that they were working with, it was a limited concept with limited budget. And when she retired, and she said, okay, we're passing it off.
Right.
And then here you were, and you had all the experience of grant writing and working with funders and so forth to move it to the next level.
Actually, not a lot of grant writing experience, but I had done legislative work for seniors.
Oh, okay.
So I had
all right.
the issues down.
The issue's down. Okay, there you go. Well, it takes both.
It does.
And so you've been able to raise a lot of money, which is needed, and because most of your staff is volunteers, the money goes a lot further.
Yeah, it does.
And Barry, what's the next step?
To improve and expand.
Okay,
Yep.
that's a safe
Always.
answer, isn't it? Boy,
You know,
I tell you.
I wanted to say one thing about the Falls program. You know, a lot of people think it can't happen to me. It only happens to people that are alone by themselves or poor. Last fall, Lavelle Edwards, I don't know if you remember him, the coach from BYU football back in the 80s and 90s.
Yeah.
He died from a fall last fall. Now, this is a guy who's well known, big family, Utah, you know, wealthy, and he died from a fall.
Yeah.
So it'll kill anybody. You know,
Well,
so-
just recently we had Roger Ailes who fell and caused the bleeding in the brain, and
Right.
8 days later he's gone.
right,
Fell in his home
yeah,
with his wife there.
right,
You know, I mean, the fall itself can happen at any time, whether somebody's there or not. But if you're not found right away,
Right. Or the complications.
Yeah,
from falling.
complications. Yeah.
Yeah, so that's one of the programs we're going to try to expand the assessment. Try to get it out, more homes being assessed, more people being saved.
You know, I can't help but thinking back to the lady I was mentioning, if somebody walked through her house with
Day
her,
trip.
you know, and just said,
Oh, yeah.
"What is this? Why is this on the floor?" You know, I think that person would remember that at least for the next few months anyway,
Right.
when they walked in the door and wouldn't put things down. And if there's one thing that scares me, it's stuff like that. Tripping over boxes, that's one thing, but tripping over something that shouldn't be there in the first place.
Yeah, could have been prevented.
Yeah.
Right.
Yeah. So welcome aboard, Barry.
Thanks. That's it.
He's
No,
a man
this
of
is-
few
this-
words.
This is a terrific organization, and it meets a need that's so vital to the community. You know, being able to age in place. Nobody wants to look forward to, well, I have to leave now and go to a nursing home.
Yeah.
You know, to be able to age in place where you're around familiar things that you've lived with all your life, and you're close to people that you've lived near all your life. You have your neighbors, your home. It's very important, you know, and that's that's how you defeat the social isolation, is to be where you've been, talking to people you've talked to, and to get a call from someone who's your own age and you have shared experiences with, that you enjoy talking to. You know, those are the things that are very important to us.
Right.
So we hope to expand the programs in the future and make Naho'oloha even better.
Very good.
Yeah.
Thank you so much. And Candace, thank you for the time you've been here.
It's been a pleasure.
What all
it's
you've done.
It's always a pleasure seeing you, Susie. I just feel like we come on the show and it's just good old times. Yeah.
Well, I think there was some sort of a spark there. I think we
just connected.
Yeah.
Yeah.
There's something about helping people, and I think all of us nonprofit executive directors have that that spirit. And that's what keeps us motivated and keeps us going.
Met a lot of good people on the show.
Yeah.
Like
Very
our
good.
colleagues here.
There you go. And so good luck to you as you return to Texas.
I appreciate it so much. I appreciate it so much.
And congratulations on a job well done.
Thank you.
And Barry, the challenge is here.
You betcha.
Okay, and we'll see you again after a few months on the job, and hope you're still smiling.
I'll look forward to it.
Thanks, Barry.
Thank you.
Okay, that's Naho'oloha and their volunteer services and how they help folks keep from being isolated and keep them on their, I can say on their toes, because you've got this program that keeps them on their toes. What else can I say? If you're not falling, you're on your toes. Did I explain that enough? Do I understand that? Yes. Okay. I'm glad there's no camera in here because that look was bad. Anyway, we're going to shift gears here a little bit, and we'll talk to the folks from Hui no Ke'olapono. Joey Gonzalez, how are you?
I'm fine. Cool.
Executive Director of
Never
that.
did this in my whole entire life, but
You what?
I never did this in my whole entire life.
You haven't ever been on the
Like, this
radio?
mic is just throwing me off, but it's
Oh,
all right.
come on. You're just talking to me. just come on up and talk to me.
Okay.
You know, I remember the first time I heard about your organization was when I was working at MEO, which is right there across the driveway from you guys at Cameron Center. And there was this, for lack of a better word, I call it a pack of people walking at about 5:30 in the afternoon. And I was going to get in my car, and I said to the person I was walking with, I said, "What's that group? I see them every once in a while." And they said, "Oh, they're from Hui no Ke'olapono." And I said, "Okay, I give. What's that?" And they said, "Well, it's a Native Hawaiian health organization, and these people this is part of their program, this walking time." And I said, "Really?" And that was the end of the discussion because we were in our car and we left. But then I started finding out that different things about your program, and of course one of the things that we knew most and I didn't realize at first was part of your program was Simply Healthy. And I'd eat there like once a week. And everybody says, "Susie, the junk you eat and you're going to Simply Healthy?" And I said, "Yeah, I doctor it up. I'm sorry." But you put a little more hot sauce on it and a little more ketchup and a little more of this and that. But it's still basic healthy food. And my favorite was turkey sandwich,
Oh.
you know. And then there were some other things. Chili was pretty good if you put some chili sauce in it. I'm sorry, I'm just
No,
messing
so the
that up
object
big
is to
time.
use the healthy food that we're actually serving, and then you kind of make the choice. You know, you get in control to make the choice.
Right. And I always believe that as long as I just touched it with that, it wasn't as bad as if I made it with that, right? And so really about once a week we'd go over there and grab for the office staff, come back with a box full of stuff.
Oh, good. And
Yeah.
you know we do deliveries. So.
Yeah. I didn't know that then. Somebody kept that from me. We rotated I have to go get it, you know? And then there was always this shrimp place down on the harbor, the garlic shrimp. I mean, the whole office smelled of garlic shrimp for days afterwards, right? And we had to take turns going for that. It's like, really, why are we doing all this stuff? We've got Simply Healthy right across the way. We can make whatever, you know. And your soups, I love them. So now you just went through a major renovation.
So Cameron Center, our landlord, went through a major renovation, and we're so across the whole Cameron Center that we're all in different sections, and they did them in stages.
Uh-huh.
So the first stage they took was the bulk of our program, which was the main Simply Healthy Cafe. They did the programs, health enhancement program. The dental program we relocated at UHMC. So it was major. That first phase was major, and it took like maybe 9 months to complete. So once we finally got everybody back into the positions of the first phase, we were able to have a small open house kind of a thing for the cafe, where we had someone doing poi pounding and giving desserts out and stuff like that. But yeah, we kind of revamped some of the stuffs, which also our logo is revamped now. This is not the one we have, but yeah, it's this one right here. But
Cool.
So we're trying to get everything going. So we're
Cool.
trying to get everything going. So we brought back our dental program into the room 21, who is the main office. And yeah, the cafe is going as smooth as possibly.
You stole my dentist, Emmy.
But don't see it as a stolen thing. See it as you can come to the Hui to get her service.
I see.
Yes. Because she's a fabulous dentist.
I know
and
she
she's
is.
making a difference with the clientele that we have.
Yeah. I went to her up country at the Pukalani Dental Center. And I went in one day when I was cleaning or something, and you know, she didn't do the cleaning. It's always the hygienist, right, that does the cleaning. But she would always come in and check the X-rays and talk story a little bit. And this guy walks in, and I, okay, where's my dentist? And she goes, oh, she left. She's down at Hui. He said Hui. It's the Native Hawaiian programs down in the Cameron Center. And I said, oh, okay, good for her. And she said, yeah, it's a lot closer to where she lives. And and she's serving, I mean, she's a great dentist, but she wanted more. So like you said, serving the population that she's serving now is more to her liking and fulfilling her goals.
And you know, basically, I think the reason why we're all at this place is because we love the mission and the how the organization work. Because you know, like here I have Suzeka Ho'ohanohano with me, and she's actually a nurse, and you can make a lot of money with nursing, but because you were the dedication, and we have the dentist also, and the dedication, they actually can make more money, but because of the love and the compassion they have for the Native Hawaiian community is why they're at this organization.
Right. And it's tremendous, and we're going to find out more about it in just a minute after we take this break.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we are back. This is Maui Nonprofit Notes, the weekly radio show where we talk story with some of our EDs and talk about their agencies and what they're doing. We're talking currently with Joey Gonzalez, who is the executive director of hello, see? I can't even read it. Hui no Ke Olapono. And he has with him Suzette Kaho'ohanohano. Kaho'ohanohano. Okay, I had the H-O, okay, in the wrong place. Suzette.
Yes.
Okay, as a nurse, what do you do there?
Okay, I am the community
Well, yes.
wellness outreach director. So they decided to give me the longest title since I had the longest name. So I actually am one of the nurses, and I oversee our health enhancement programs, which have to do with health education and prevention. So I work with these awesome nurses and healthcare workers, and we go out and we do the outreach for our programs. So we go out into the community, we do community screenings. We do the group that walks around the Cameron Center that you had mentioned.
Oh, okay.
And that is our Me'ai Pono program, meaning to eat right. And what we do is we educate people to actually change their lifestyle, change their, behavior, so that they can learn how to eat right to manage chronic illnesses, lose weight, things like that. We do community health screenings and different things like that. I also, because I've been here so long, I do the quality assurance, and I do all of our data and things at the Hui. So, like I said, I have an awesome staff. I want to say and we also have a satellite office in Hana, where we have our Hana office out there that also offers most of the programs, but not all of the programs to the community of Hana.
Interesting.
Mm-hmm.
So, how big a staff have you got? I mean, you've got a lot of programs going on.
We have 41.
Wow. See,
And we're solid with 41.
Yeah. And see, I never would have guessed that from what I initially knew about you guys. Because I knew the cafe, I knew the walking group. That was kind of it. But now, as your funding is primarily from the various sources that fund Native Hawaiian programs on the federal level.
Right.
Right?
Through HRSA.
Right. But you can serve non-Native Hawaiians.
Yes. Our target population is Native Hawaiians, but we do not turn anyone away. So anyone who walks through the door, we service, unless they are not a Maui resident, because we are one of 5 Native Hawaiian healthcare systems in the state. So it's kind of a little territorial. So if someone actually is a resident of Oahu, we cannot actually service them, because we have our sister agency there, also Molokai, Kauai, and the Big Island. But anyone who is a Maui resident, can receive services from us.
Okay. Now, we talked about the dentistry. You don't have doctors on staff.
We do.
You do. Okay. So, I mean, do people come to you with a cold, with the flu, the strep throat?
So another
the
awesome
whatever?
thing that we have is the clinic.
Okay.
And it's called Imioloho. And basically we're, I don't know, clients.
382. I do the data. Sorry. So this year, last year they serviced about 382 patients. We have Dr. Heather Haynes. She's an internal medicine doctor, also a Native Hawaiian scholar. And we also have Noel Withers, who is our nurse practitioner. So those 2 staff our clinic there.
Okay, so they can. I guess I'm just curious about how this all works. When it's dedicated to the Native Hawaiians, but I mean, because it's federal funding, and even though it's dedicated to that, you got to be able to serve everybody.
Right.
That walks in the door.
So it's kind of complicated. So we actually came about many years ago. I want to say I've been here this week. I'll be 20 years, and Joey's like
24.
24
Wow.
years. So it came about from a Aola Mau study, where after, the Hawaii became a state and no longer was a territory, and the changeover of the queen and things, they did this study, and they found out that Native Hawaiians ended up falling into like a depressed mood, where we started getting more chronic illnesses such as hypertension, diabetes. Lifestyles had changed, so this Aola Mau study actually proved through research that the changing over of the Hawaiian culture to the Western culture put the Hawaiian people into a depression, which caused all of these health issues that came about. So the federal government then offered this funding to the systems on different islands to help. So that's kind of like how we came about, and through that they also offered Native Hawaiian scholarships, which I am a recipient, Joey is, Dr. Heather Haynes is. So we have a lot of healthcare providers who are Native Hawaiian scholars, and part of what we did was that they paid for us to go to school, become health professionals, so that we would service a population like that. And after our years were put back like we were supposed to, like for example, I think I got 2 years of the scholarship money. After 2 years I could leave, but our dedication and passion
You're
to
hooked.
service the people came about. So anyways, they gave us this money, and because of federal guidelines, it's kind of like it's a balancing act. So it's like you have to make sure that you're servicing the right population, but you can't turn anybody away.
Right.
So that there's not any kind of discrimination. And I think we're still kind of confused on how to go about doing this. But we also have Lomi practitioners. So we have like four of them.
That's what makes us
and we
different from
offer
the others.
Lomi.
Yeah.
So we try to offer more culturally competent medical services to the community and stuff like that. But yeah.
Now, is this do you take like insurance, or is this a free service to people, or?
No, we take insurance.
Okay, so there's a fee schedule.
Right,
There's a
there
sliding
is,
fee schedule.
there is a
Okay.
sliding fee schedule for those who can't afford. So with Dr. Heather Haynes in our clinic and stuff, so one of our goals is to make sure that everybody has access to health care. So if they come in and they don't have health care, my staff will then, kind of like you walk through the front door, you sign up. After you sign up, we take your vitals and everything, and a nurse comes in and she assesses you. And she assists you not only physically, but mentally and holistically. So we kind of try to look at the whole picture and stuff. And one of our things is to make sure everybody has health insurance. So our clinic takes health insurance. We take everything except Kaiser. But then I want to say our dentist also takes insurance. And for those who don't have insurance, we follow the sliding fee scale, the federal guidelines. So you can fall on the federal guidelines, and we can decide then if you fall in the poverty level, if you can have like 80% cut off your bill or 20%, depending how your income is and stuff.
I see. Okay, and that's where the federal funding comes in to help cover that.
Right,
Keep you
cover the
operating.
difference and
Yeah.
stuff. And our grant is kind of like, and I guess we're fortunate, for every $5 they give us, we have to match it by $1, whether it be through monetary money coming in or volunteers, services, anything like that.
In kind.
Right,
Mhm,
all
okay.
in kind.
Okay. Interesting. Okay. That's neat.
Interesting but neat, yeah.
Yeah.
Yeah,
Because you have to go through some nicks and crannies to get to your goal.
yeah.
Gotcha. It's fascinating to me to see this program now. You're talking, how long ago did this start?
25 years last year,
Yeah.
right?
Okay, so you've been there almost the whole time.
Yeah.
Wow.
And I started off as a healthcare worker.
You did.
And I went through 7 executive directors.
Yeah.
Which is cool because they started the foundation and they did all they took the chance on certain stuffs where it would work. They took we pick and choose some of stuff. Our Maui program, which is an excellent program, it's a diet and exercise program. It started where we had them coming breakfast, lunch, and dinner.
Really?
And the outcomes was beautiful, and it lasted for 1 month and all this kind of stuff, and the outcome was beautiful. But then tracking them after that was the part. So then we had to change the program again. I think, Suzette, we changed it like maybe 6 times.
Yeah, right, yeah. So we constantly are evaluating it to make sure that, for quality assurance measures. And like Joey had mentioned, when we first had our Maui, we had these wonderful short-term outcomes, but then over a year, people eventually started to gain the weight back. So with our awesome staff, after we get done, plus the feedback from our clients, we always reevaluate our programs to see how can we make it better? How can we keep these people healthier longer over a long period of time and stuff, so.
Interesting. So over the course of 6 or 7 executive directors, you kind of moved up a little bit each time? Until now, how long ago did you become executive director?
4 years.
4 years. Okay.
April.
Okay. So you've had all the fun of the transition and the
fun, the
redecorating and
challenges,
the
yeah.
Oh yeah. Okay.
But of course, that's not our house, right? So
Right.
we want to save the money when we get our house to put all.
Is that a goal?
Hopefully, yeah,
Yeah.
we're working it. But you know how
That's in our
budgeting is
plan.
and everything.
Yeah.
So 98% of our budget our funding comes from the HRSA. The other 2 is those fundraising. And I just wanted to mention that we have this collaboration between ourselves, Queen Ka'ahumana Shopping Center, and Metagold. And what it is move, it's mall walkers. So Groove to Move. And it's held Tuesdays and Thursdays from 10 to 1. It's open to the public, and it's just encouraging the community to get out there and walk. And basically, we grab those kupuna programs that's actually in existence. They take the people to the shopping center. Let's go walking, and there's certain things that they can get. Like one of the stuffs is $25 worth of Metagold products.
Wow.
So it's a good thing all around.
Yeah. Interesting.
And it's free.
And it's free.
It's free, yeah.
We
Well,
just
we'll share
encourage
that
you to
with
get
us.
out
Oh,
here.
cool, yeah.
I mean, I think this would be wonderful. We
Yeah.
have all of
And
these
exercise.
volunteers. Yeah, I think this would be great. Thanks.
And all we have these volunteers, and they sit there and they're like, okay, here, one. Okay. One. But, we couldn't have done it without them. So
Absolutely. This is
awesome
great.
staff, awesome volunteers, and that's how you make this world go round here on Maui.
Right. Right.
Good.
Definitely.
Interesting.
Yeah, that's
I'm in awe. Here I was across the driveway from you guys for 7 years, and I had no concept of how huge your program was.
Yeah, and it was so good because it's this like she mentioned, this awesome staff. They actually got to create this thing. So what you saw at that time was one nurse standing at the beginning, and you just monitor, you time them how fast they come around, and then that's their pre. And like how we do pre baseline, so you do your blood pressure, and then you do it after again, and you see the difference. And that's what our funders wants to see. Yeah, they want to see that.
Right.
The awesome outcomes.
That we're doing that.
64 laps. Is that correct?
So 64 laps throughout the whole session can get you
Yeah.
a $150
Wow.
medical gift certificate.
How far is a lap?
64 laps. Are
So
you
far is
kidding?
a lap?
it's the shopping centers. So you just go inside of Queen Kahamanu,
Right.
and then that's a lap.
Yeah.
So you do it
walk around.
64 times.
Well, you have from 10 to 1
Yeah.
o'clock. You only do like 10 a day or 3 a day.
Oh, okay.
So it adds up within the
And
session.
it's different
Gosh,
sessions,
yeah.
Yeah,
It's
it's
so
different
many
sessions.
days.
I love it. That's great.
I'm not sure if the dates are
There's
on there.
so many
but-
sessions to do it.
Yeah. Like
Okay.
I want to say a couple of weeks to
Yeah.
do this. Yeah.
I like
Great. I'll put this out. to
Yeah.
I like he mentioned board members is fabulous. So our board member actually is there trying to
Yeah.
maneuver this thing.
And she got the volunteers to
And
come
she
in
got
and help
the
with that.
yes.
So thank you, Daryl Ty.
We greatly appreciate.
Yes. What would any organization do or be without its board members?
Yeah.
Not to mention the fact that they hire the executive directors and keep us in line. sometimes we have to be kind of pulled back into place. But it's just, I don't know. I think I like the idea of like you moving up through the ranks. You know, I like Barry coming out from the board onto the firing line, if you will. I'm not sure how I got there.
Well, even with your, I mean, if you can look through your archives, you guys got me on House 19 years ago
Yeah.
when Linda Lingo was there.
Did we really?
Joanne was the
Yeah?
person at that time. So I like how everything intermingles and
Right.
yeah.
Yeah,
So
we've had a bunch. I'm so glad to hear that. We've got a bunch of housing programs over the years, not just houses that we built, but how we helped fund and get people in. Was that one of the first time home buyers
the first
grants?
home buyer,
Yeah. A lot of people that way.
so the amount was horrendous. Now it's like a little less, but it's all right.
Right.
At least it's something that people wouldn't have. Yeah.
It helped get people into homes. Yeah. It's we've worked our way around the circle, haven't we?
Yeah.
That's incredible. I know that's what I love about this show. We've got Naho Aloha's going to bring people out and start walking.
Oh, that's so excellent.
Awesome for them.
And I'm just fascinated with your program, and I hope that the audience out there that's listening maybe has found another way to get some assistance with any health issues they have that maybe they just flat out couldn't afford to, or felt they couldn't afford to try. But you know, I'm kind of like with you guys. It's how can you say I can't afford to find out what I have? You know, there's an issue here, and I've got to learn what it is. And I don't want to hear bad news, but yet, if I hear bad news soon enough, and I can fix it,
Right.
it's a good thing.
It's treatable.
Yeah. And so often we just kind of put it in the back burner and say, oh well, when I get that pain again, I'll think about it. Not the way to do
And
it.
I think that's what we really want to encourage is that people aren't afraid. So as you can see, I am an RN, but I don't wear scrubs and stuff like that. And we just don't feel like stuff like that is culturally competent because it tends to scare people off. And our doctor doesn't walk around with a lab coat and stuff. In fact, if you walk in there, you probably wouldn't know who was the
Who was the
executive
doctor.
director or who was the doctor or who's the nurse. A separate... The dentist has scrubs, but you probably think that she might be like a nurse's aide or something.
Right.
So we just want to encourage people that we do like health monitoring, which is a free program that we have there. And it doesn't matter which doctor you go to, because I want to say 30% of our clientele do not come to our doctor. They go to outside doctors, but we do offer free health monitoring for people to come. So we just like to encourage everyone, come down, sign up. Come in once a month, do your blood pressure. I mean, that's the silent killer. People don't know until the heart attack happens. And unfortunately for women, the first one kills you. So please come down, sign up, and we'd like to
Right.
see everyone.
And I got to cut you off because we're at the end of the show. Wow.
Okay, thank you.
Maui Nonprofit Notes is sponsored as a community service by Pacific Source, the builder's choice. Please give Paul and his staff a call at 986-0380 or stop by their showroom in the Waikapu Base Yard on East Oahe Way to see how they can help you with your building project. We want to thank the folks that visited with us today. We got Joey Gonzalez of Hui Nui. Yes. I'm getting signals from the
Hui no, the Hui.
Yeah.
I'm getting signals from the engineer. Hui no ke Olapono, and we had Candace Carter and the incoming executive director Barry Gay from Naho Aloha. Thank you all for joining us today, folks. Have a great week. Aloha.
Aloha.